Hey, what is happening, family? Welcome back to the QL show, the QL experience. I'm so excited because, usually I don't come on around this time. I don't come on to usually like after like 3, 4 o'clock. But I think it's really important that I bring you on just an hour a few early to kind of talk about our back to school block party tour. Of course, we have partnered with Absolute Total Care, and now Regenesis Healthcare is a part of this as well. I have the chief medical officer on the line with me today. She goes by the name of Dr. Jami Coakley. Hey, Dr. Jami, how are you?
Hello, how are you today?
I'm doing amazing. How about yourself?
Doing well, doing well.
Dr. Coakley, I mean, kind of start. Well, first of all, am I saying your name correctly? Dr.
That's
Coakley?
correct. Yes.
Okay, cool. Start off with telling us a little bit about yourself and your role at Regenesis Healthcare as the Chief Medical Officer.
Okay, so as the Chief Medical Officer, I am responsible for overseeing the clinical division of the organization.
Uh-huh.
So within my division, we have our primary care providers, our pediatric providers, we have pharmacy, dental, behavioral health, psychiatry. And so all of those providers, support staff, including nurses, dental assistants, pharmacy technicians, all fall under my wheelhouse. And so I am responsible for providing leadership and supporting them as they strive to provide excellent care for our community.
Absolutely. So, like, why do you think like that Regenesis as a company was motivated to partner with this on this ninth annual back to school block party? I mean, we see you guys out in the community all across Spartanburg. I mean, at least, if not every week, every other week, but now to come on to this back to school block party tour, talk about that.
Right, absolutely. So, part of what we do is to be involved and partner with our community. As
Yeah.
a community health center, we provide health care, but it's in partnership with the communities that we serve. And so, when we think about all those things that drive and determine health outcomes, education, and economic stability, access to health care, neighborhoods,
Yeah.
networking are all critical pieces in that. Include again, we mentioned education, and so when we think about back to school, we think about kids. Of course, we know the cliche, but it's so true. The children are our future, and so when we train them, when we educate them, when we express upon them the
Absolutely.
importance of knowledge, but also being and living healthy, it follows along so that in the
Yeah.
future our communities are healthier and thriving. And so anytime we have the opportunity to again work in our community and enhance the outcomes, quality of life, um, of the children and families in our areas, we always want to jump on those opportunities to do that.
Cool. So again, family, like the back to school block party will be going down this Sunday at the Dr. TK Gregg Community Center. Kickoff is at 2 o'clock. We have Regenesis Healthcare who is now coming on, partnering with us. This is going to be a lot of fun. Can you talk about any of the health initiatives or just any services that you guys may be offering the day of, if so?
So, day of, I think most likely we'll be on site available to provide information.
Yeah.
Again, that's always the first step. So, reminding people of the importance of preventive screening. So, specifically for kids, we look at parents and go, is your kid up to date on their well child check? Have they
Right.
had that annual visit that fits in with those milestones and that schedule of it's time to check growth, development, progress, and all of those things? Um, a lot of times we go, if it doesn't hurt, don't fix it, right? Or,
Right.
I feel fine, but how do we prevent things and prevent those situations that can be
Mhm.
avoided by being on the early side? And so having preventive screenings. Um, in August, especially with back to school, we talk about immunizations. So are we appropriately vaccinated on those recommended schedules so that we can prevent those diseases and issues that we have vaccinations against that have been proven to reduce the risk of disease and also are proven to have very low risk of side effects and undesired effects. And so vaccines are one of the biggest contributions that we have to public health. And so that's another thing that we think about in August and with back to school. So again, mostly on site to provide
Yeah.
awareness, provide education, and then again, be able to step up and say, if you need an appointment, we can take care of that too.
Absolutely. It's so cool to hear you talk about health education because it seems to be that you're very passionate about it. And one of the things that people have been talking about is like this new wave of COVID that could be coming, here to the upstate. And like, is there any things that you guys are doing in particular to kind of help us on the front end? You know what I mean? Maybe it's the COVID vaccinations or anything like that.
So, biggest things at this point in this stage in the game are again awareness, being
Yeah.
mindful, and so definitely COVID infections are on the rise. We are seeing more positive cases here and there, things popping up, more people calling out sick, more people coming in sick. And so, all of those first line things that we talked about in the thick of the pandemic, but go
Yeah.
social distancing, washing your hands,
So you
covering
think
your.
that we will go back to like a time of like social distancing again?
And I mean, I think not as definitely not as strict as
Yeah.
before, but even still, just being mindful. So if you wake up in the morning, you're like, my throat's a little bit scratchy, or I'm a little bit congested.
Yeah.
Then the most effective thing to do is to keep your distance a little bit, because if it is COVID and you just haven't been diagnosed yet, then you don't want to go and spread that. And so you go, okay, how can I manage that? Where can
Right.
I again keep my distance? If I really don't feel well, maybe I still go out, but I go ahead and put on a mask just in case 2 days from now I go and take a test and I am
Mhm.
positive for COVID, because we always have to be mindful of, even though in most cases, we are very healthy, we come into contact with people who are not as healthy and have autoimmune diseases, and their immune systems are not as strong. Again, infants, older people, pregnant people, people with asthma and things like that. And so, anytime that we can limit exposure to other people, just makes us better off in the end.
Absolutely. Is there any like health trends or concerns that like we're actually like dealing with in our community that Regenesis Healthcare is trying to attack like firsthand that we can talk about?
Always. Always, right? So,
Yeah.
again, prevention is key. Don't wait until you feel like there's a problem. How do you keep up with your preventive screenings? How do
Yeah.
you know those numbers? Are your blood pressures within normal limits? You know, what's your A1C if you have diabetes or it could be pre-diabetic, those kinds of things. So the more we can stay on the preventive side, then the less we have to do as far as invasive treatment, medications, and things like that. There's always the stigmas and things associated with people not wanting to take medication. Well, the
Yeah.
best way to avoid that is to prevent the disease and to start with, right? And so thinking about diet and exercise and all of those things. I'm a dentist, and so how often do we think about teeth as being the part of the Colgate smile, but teeth is
Right.
part of your. And so, too often we see people who haven't had a dental checkup in 2, 3, 4, 5, or 10 years. You got to stay on top of that too, so you can catch things early.
Yeah.
Um, when you first said that, there was something else I thought of. So one thing we are doing is working. Um, we are starting to really focus on and work around HIV and AIDS education and also prevention.
Yeah.
So screenings and things like that, knowing your status and keeping up with that. And again, stigma. We don't know the unknown and all of that, but are we really staying on top of it, or are we avoiding those things just because we don't know what might come? And
Yeah.
so being aware of HIV, AIDS, what are the options for prevention? What are the options for treatment? But not being afraid or avoiding those things again just because we don't know.
Yeah. Ooh. Listen, Dr. Jamie Coakley is live in the studio with this family. Of course, we're talking about the ninth annual Back to School Block Party that is going down this Sunday at the Dr. TK Gregg Community Center. I'm so excited because I have known Regenesis ever since like I was a kid. Do you remember you guys were doing like the back to school bashes like a long time ago? Like I was one of those kids that was coming to those back to school block parties. So now to be able to collab with you guys, I mean, it just makes perfect sense. And I'm so excited about this. So we're going to have a money machine there, Dr. Jamie. So the kids
Big
are gonna be able
time.
to get inside the money machine, take free cash money home. Of course, you guys are gonna be presenting laptops and TVs on Sunday as well. It's gonna be a lot of fun, and we like to do this like the day before school starts back. So it's kind of like the official last block party of the summer.
Absolutely. Keep the excitement going.
Yes. So, family, again, it's going down this Sunday. Tell a friend and tell a friend. Regenesis Healthcare is going to be in the building, and they'll be able to learn more details about you guys and all your locations and all that good stuff as they're there as well.
Absolutely. Yes.
Okay. Well, all right, family. Again, Dr. TK Gray Community Center this Sunday. Tell a friend and tell a friend. Kickoff is at 2 o'clock, and we got to give a huge shout out to Regenesis Healthcare for allowing us, you know what I mean, to partner with them and put this all on. Y'all have a good one, and I will be back maybe around like 4 or 5 o'clock. Y'all know tonight is National Night Out in Greenville, so I'm going to be hanging out with the city of Greenville tonight. But definitely check back in with me at the top of the hour at